Thank you for the opportunity to present our research all the way from Melbourne. It's a pleasure to be here. I'm going to talk about sacral neuromodulation and detrusor underactivity. These are disclosures. ICS defines underactive bladder as a symptom characterized by slow stream, hesitancy, straining, and feeling of incomplete emptying, whereas detrusor underactivity is a sign measured by urodynamics of a impaired contraction resulting in either prolonged bladder emptying or failure to completely empty within a normal time span. Detrusor underactivity is a challenging condition to treat. It's often underrecognized, poorly understood, and there's a long latency to diagnosis and treatment. As such, predictors of response to S&M are unclear for these patients at this point. And so we sought to identify predictors in these patients and to aid us in better patient selection and counseling of outcomes. This was a prospective study of consecutive S&M implants over a 5-year period. All patients had preoperative evaluation and VUDS, confirming DU, which we defined as bladder contractility less than 100. Other inclusions included symptoms for at least 6 months and at least 18 years of age. We exclude those that did not have complete VUDS or bladder contractility greater than 100, as well as concomitant obstruction, prolapse, and incontinence. Other contraindications to S&M implants were also excluded. And all patients underwent stage trialing for S&M. Follow-up period was at least 6 months. These are our results, and as you can see, half of these patients had good response to testing phase implants, meaning at least 50% improvement. And when we break down our subgroup analysis, what becomes clear is the importance of preserved bladder function in response to S&M. Those with detrusor function intact had better response rate than those without. And when we looked at voiding, there was no differences found, which makes sense, as voiders could still have confounders such as those without detrusor function can still void abdominally rather than true detrusor function. And this confirms the true value of urodynamics. And as well, looking at etiology, neurogenic versus non-neurogenic, there was no difference. To reiterate, in properly selected patients, S&M is very helpful, and our study showed that patients with detrusor underactivity with preserved bladder contractility are more likely to respond to S&M compared to those without detrusor function. Other preoperative characteristics we looked at were non-predictive, and so our study confirms the usefulness of urodynamics in identifying those patients with preserved contractility as a predictor of response to S&M. And as with any implantable device, patient counseling and management of expectation remains paramount part of the selection process, and appropriately selected patients have improved outcomes and better quality of life. So thank you for your time. I will be happy to take any questions.
Yes, Howard.
Howard Goldman, US. Very nice study. So the question is, clearly those who had some preservation of detrusor function did better, but those who didn't have preservation, who truly had detrusor underactivity, did some of those respond as well?
Yes, so they did, just less so. And I think in a future study, now that we've proved this observational evidence with larger numbers, we can maybe substratify the different, maybe have some kind of brackets of the actual BCI index to see if there is a trend towards that.
Right, because it would be nice, because as long as it potentially works, it's hard to deny someone that therapy. Maybe it's better for counseling, but it'd be nice to figure out a way to really say, you should try it and you shouldn't.
Yeah, absolutely, I agree. That's a good point, thank you.
I have a question. I'm curious regarding the potential gender differences. You had 49 men and 19 women. Were there any differences with regard to response there?
So we did look at that. It wasn't powered to exactly find that out, but there were no differences in gender.
Is it perhaps that women are more prepared for clean intermittent self-catheterization, whereas men prefer not to?
That could be a good hypothesis.
And what is the difference in cost between this technique and clean intermittent self-catheterization? Have you looked into that?
No, we have not. Thank you.
Are there any other questions? Well, thank you very much.